welcome. Gonna give folks a little bit of time to join us here. Thank you for being here on Thanksgiving long weekend. My name's David Drapkin from Psychedelic Today and Vital, and I'm here with Juliana Mulligan. How you doing, Juliana?
I'm doing great. I'm happy to be here with you guys.
Yeah,
Mhm.
always good. We've had many good chats, so it's I think this is probably episode 3 or 4 for us now. So it's really good to have.
Probably, yeah. Hmm.
So I think we're good to get started. As I said before, we're just going to talk for about an hour. So in that time, at any point, feel free to drop in questions. So um, we can't see you, we can't hear you, because this is a webinar. So what that means is you should be able to see Juliana and myself. Um, when we go to Q&A, if you would like to ask a question yourself, then yeah, we'll just open up your microphones so you can ask that question yourself. No problem. All right. So I think a nice thing to do to start with is to introduce Juliana. So Juliana Mulligan is a psychotherapist who's a formerly opioid dependent, formerly incarcerated, and has been a working member of the Ibogaine treatment community for 11 years. In 2011, with the help of Ibogaine treatment, Juliana left opioids behind and set off on a path to transform the way drug users and their treatment is approached. She has a master's in social work from NYU, was the psychedelic program coordinator at the Center for Optimal Living for 3 years, and is currently a consultant for the Kentucky Ibogaine Initiative. She runs Inner Vision Ibogaine, which supports people in preparation and integration around Ibogaine treatment and offers consulting services. She's worked in multiple Ibogaine clinics, presented at various psychedelic and harm reduction conferences, and is the author of the Guide to Finding a Safe Ibogaine Clinic and co-author of Firesides Warning Signs when selecting a psychedelic facilitator. She's taught about Ibogaine at Charité University in Berlin and Southwestern College in New Mexico, and has written for multiple publications about Ibogaine, including Double Blind and Chacruna. Most recently, her focus on abuse and ethics in the Ibogaine treatment space has led to her survivor advocacy and client support work. Welcome. Really good to see you, Juliana. Thanks for joining us again.
Thank you. Thank you so much.
Yeah, yeah, it really is a pleasure. So, um, Juliana and I have had a few chats in the past, and the topic of Ibogaine always comes up. The topic of substance use comes up, and in the past we've talked about ethics, we've talked about trauma, we've talked about kind of systems and access, and how to just think through like what's it going to look like in the future, but also just what is happening right now, particularly with Ibogaine treatment for substance use. Um, and this talk was originally going to be around the Kentucky vote that was scheduled for, I think, this week, but that's been postponed. So we're still taking like the general themes of what we were going to be talking about, but we can't deconstruct a vote that hasn't happened yet. So it's been postponed. And Juliana was just saying we don't know yet when that's happening, the new vote. But yeah, just massive things are happening in the psychedelic space right now, and it's not all corporate stuff with FDA trials and intellectual property. Some of it is decrim, and it is statewide legislation like Oregon, Colorado, and Kentucky. So that's why we're calling this a vital psychedelic conversation, because this is something that is affecting millions of people in Kentucky and beyond. Um, so I think maybe Juliana, I'd love maybe a place to start around just conceptualizations of trauma. Um, and for me personally, I'd like to just start by saying I never really understood what trauma was until probably 4 years ago, working in a hospital when I contracted a trainer to come and do like a 1 day teaching about like what is trauma, because it was like the buzzword of the time. And we
Hmm.
realized that our social work team just didn't know what trauma was. And I realized I was the director of the department. I didn't know what trauma was like deeply. And as I've been using psychedelics in my life, I just feel it so much more like in my body. So for me, like my understanding of what is trauma, it's become less of this concept and a word to do with like car crashes and war. It's more like, oh yeah, that's what I feel in my body kind of pretty much every day. Like, and I know where it is, and I know kind of when it gets more difficult and what helps it. So for me, it's just become more personal and embodied, just what I understand and define by trauma.
Hmm.
Is it okay to ask you for like how's your journey been evolving around understanding and experiencing of trauma and how to conceptualize it when talking with folks about trauma?
Well, something that I think a lot of people associate trauma with these singular, really intense events. And actually, one of the trickiest traumas to work on are daily subtle traumas that can go unnoticed, especially when we're children. I think one of the biggest things that I work with as a psychotherapist is what we call little t traumas. So, for example, an emotionally unavailable parent who is that way all of the time, and you don't know any different because that's what you've been raised by. And so you don't know that something is wrong, because that's what's normal to you. But having an emotionally unavailable parent is an abandonment trauma, even if they're physically there. And it's actually more confusing because they are physically there. So you think nothing's
Mm.
wrong. They're here and they're, seemingly doing caring parenting things like bringing me to school and making me food, or, whatever daily caretaking actions would be, but they're emotionally not present. Especially those of us who have parents from boomer generation or older. I mean, and other generations. I think Gen X has this too, but especially boomer generation that was raised with just suck it up and keep working kind of ethos. Don't talk about how you're feeling. When you grow up with parents like that who don't talk about how they're feeling, you can really feel that something's being unsaid and they're not there for you. And that's really traumatic to have somebody who's not emotionally present for you on a daily basis. So a lot of the trauma I work with is this emotional abandonment trauma that often goes unrecognized because it's so normalized. I mean, even within capitalism, it's normalized to just suck it up and keep working and not talk about your feelings. So that's the other trauma I want to talk about is systemic trauma. Just how our society is constructed is traumatic. The whole ethos of capitalism is traumatic. It places our value as a human being on our production or how well we do in school. That starts as since we're little kids. Our value as a human is how well we do in school. It's a completely awful thing to tell tiny children. And then when you get older, it's all about your career and how much money you make. These are really traumatic things. And to me, from in my experience and from what I've learned, I think these are the most traumatic things is the way our society tells us where our value lies as a human being. And I think most people who struggle with substances or other destructive behaviors are just trying to survive capitalism. And they're just trying to survive this suck it up and keep working, don't talk about your feelings. Work is the most important thing environment. It's super toxic. I don't think anybody would want to dissociate with substances if we didn't live in such a traumatic environment like this. So yeah, that trauma. So that's really the big thing I've learned about trauma is it's not just these big singular scary events. Because for a long time I thought, what happened to me? Why am I in so much pain? What even happened? My parents took care of me. We went on trips, but it was daily traumas. It was small little daily traumas, and it was also the trauma of growing up in a system that prioritizes making money and career. So yeah.
Yeah, that's a really easy point to miss, I think, and that was part of what I had realized around defining trauma and understanding it as a therapist is that because we're living in it, it's really hard to step out of it to see it, to be able to like just identify what it is that we are living in this, very traumatic culture and a traumatic time, in particular. And how do we step out of our reality? How do we get like a fresh perspective? And I think that's why psychedelics can be really helpful.
Mhm.
And often people that are using psychedelics, you know, they'll realize, oh gosh, yeah, that I did experience trauma. Like they're remembering incidents, but they're just seeing things that they had already remembered from a different light and going, oh wow, that wasn't okay. Well, oh gosh, that really hurt me. Or God, God, I can't believe what's going on in the world right now. That this isn't okay. But yeah, I'm kind of just thinking it's normal. And I think we become a little bit numbed and desensitized to it because we feel powerless to change things. Or so we just kind of keep going with it, but it's affecting us like without our knowing, I think.
And especially in the world of addiction treatment, when you go to most treatment that's abstinence only or 12-step based, they tell you that the problem is within you, that you have the disease that creates the problem, which is not true. And there's no scientific backing for the disease concept. Um, and the issue is society. And, when I went through rehab and mainstream treatment, there was no talk about the abuses of the system we live in. There was no talk about systemic oppression or racism or patriarchy or the history of colonization, or that capitalism is toxic. There was no talk about this. And so then when you go to treatment to get help, they reinforce the notion that it's your fault, as if you live in a vacuum and not within a system.
Mm.
So I think our treatment is also re-traumatizing. And unfortunately, I do see it in the psychedelic therapy world as well. People perpetuating this notion that, all right, we have to get you better so that you can get back to work, so that you can become an upstanding member of this toxic society. So I think the issue is like, how can we not carry over these toxic societal ethos into the psychedelic world? Unfortunately, I see a lot of narrow-mindedness on this topic, and there's not enough education about social justice. It's getting a little bit better, but the people that need to learn about social justice concepts and how they relate to mental health and psychedelics are usually not coming to those talks, or they're usually not taking those webinars. So we need to figure out a way to get these ideas to the broader psychedelic public.
Yeah. And I feel like one of the differences with psychedelic assisted therapy treatment is its ability to heal at the source, whatever it is, for each person uniquely, individually, that needs to be healed, that it's just waiting to be healed. It's just waiting to kind of say, yeah, here I am. Please help
Mhm.
me. Like this part of me inside. And when I tell people like how I ended up working in psychedelics, I've got different answers. One of those is because I've been using psychedelics for my own mental health, depression and OCD. And they really have helped me throughout my life, and cannabis. Um, and then the other reason is I used to be a director of an outpatient addiction center. And I hate slagging them off because they were great, like best of the best, top in New Jersey, like evidence based, beautiful building, taking insurance, great protocols, well trained. But because I knew the power of psychedelic therapy to heal trauma, and we didn't have any of those tools, we had, CBT, cognitive processing therapy, EMDR, prolonged exposure. It's a great cognitive behavioral techniques and trauma focused. But because I knew the potential for psychedelics, I remember just sitting with one client, and I had like a 45-minute session with her. And it was almost like I could hear that part of her that was deeply traumatized, that had been in and out of rehab and detox 10, 20 times. It was calling out, like, please help me. Please let me get out of here. I don't know what to do. Like, I'm stuck. And I've got like a 45-minute session, and there's people outside walking around in my office. And I just realized, gosh, I can't do this anymore. I just have to be able to offer people psychedelic therapy. And, it's not ready for that yet. So I really feel like it's hard not being able to offer alternative treatments. And that's why people are going to, underground places where it's not being offered, legally, in clinics and hospitals and doctors' offices, because they need it. And maybe they can't fly to Jamaica or Mexico. So they're finding people on, Signal and Telegram and, different websites to find folks to get that. But it's because psychedelics have the potential to really allow someone to find, yeah, their wound, their trauma, and the need for healing. And it wants to be healed if we have the right tools, in a sense, to locate it and invite it to share its teaching.
Mhm. Yeah, and that's why I'm so excited about Kentucky, because as I've talked to you about previously, we've got a big problem with safety in the Ibogaine treatment world. I mean, there's a ton of clinics outside of the US, and right now I think I have 5 on my list that I feel safe sending anybody to, which is really bad considering there's at least 5. And so with Kentucky, if it passes the vote, what's really great is that Kentucky can set the precedent for a safety protocol, a standardized safety protocol, not just for the treatment, but a protocol for preparation and post care as well. Because we're not planning on just sending people through a trial and sending them home. We're planning on having a continuum of care going on for months afterwards. And so we're really hoping that what happens in Kentucky is going to set the standard for what treatment is like in the rest of the world as well. We've talked about my story in the past with what happened during my treatment. There's still people that end up hospitalized. There's still people that get sent home who are really sick. I just talked to a woman the other day who was sent home from a clinic so ill they wouldn't let her on the plane. It's like, why is this happening? We have to do something to standardize these protocols and to make sure that people are being treated by not just professionals, but professionals who are under some kind of supervision and regulatory process. So it's really exciting. Oh, Karen's here from the commission. Hi, Karen. Um, it's really exciting that this could be happening in Kentucky, and I have a lot of confidence that it is going to pass the vote. And yeah, I'm happy to dive in and talk a little bit more about what's going on with that project if you'd like.
Oh, yes, please. Because I know in the past it was hard to talk about it sometimes, but I think that's what a lot of folks are here for. And yeah, so maybe just take a step back. Like, why Kentucky, and what were the reasons for this in Kentucky, this initiative? And yeah, how did it all start? Perhaps could we start with that one?
Yeah, I mean, it kind of came out of the blue for me, that's for sure. The head of the commission, Brian Hubbard, found me in the summer of 2022. I think it was a journalist who had seen me speak at Horizons recommended that Brian talk to me about Ibogaine because he was interested in it, as it has the research shows it has amazing effects for opioid use disorder. And so I talked to Brian. I got on the phone with him. I think it was July or August of 2022, and I was blown away that this person who is head of the Opioid Abatement Commission in Kentucky had so much interest in Ibogaine, and I immediately connected him to all of my favorite doctors and researchers in the field. We were all excited about it. We thought that maybe this would take years to happen, and to our surprise, the Attorney General of Kentucky, Daniel Cameron, approved it not that much, maybe 6 months after I had first talked to him. It really happened quite rapidly. And it was, for me, it's like a dream because ever since I did Ibogaine in 2011, I wanted to work to make it available to more people in the US. And so I felt really honored and lucky to be able to give some of my advice and share my experience and training with Brian to make this happen. And so that's how it got going. And we've had a number of public hearings with speakers from veterans to researchers to doctors to people like myself, sharing about experiences and research and treatment experience to educate the public, because there's definitely some negative press around Ibogaine because it is a dangerous medicine that requires a medical protocol, just like any medicine in a hospital. It requires a safety protocol, and unfortunately, not everyone's followed that, and so that's why there's negative outcomes that have happened. But when done safely, it's completely safe medicine. And so we've done a lot of public education events to get everyone on the same page about how Ibogaine works and what its treatment requires in order to be offered safely.
Why Kentucky? So what were some of the particularities around the situation in Kentucky, maybe with opioid using individuals, overdoses? I don't honestly know what the data points were, but from what I've heard, sounds like there was almost like a state emergency, like a federal emergency, but a state emergency
Yeah.
called like we need help here because we don't have the tools, the systems, the ability to help our people stop dying.
Right. Kentucky is one of the states that has been very hard hit by opioid issues with overdose rates. And like when talking to Brian and other people in the state, and they tell me about the difference from 10, 20 years ago to now to what you see in the small towns, that it's really striking and heartbreaking. It sounds like everyone knows somebody who's had an OD or who's almost had an OD or who's really struggling and who's been through a lot of treatment and it hasn't worked. So I think Kentucky is particularly feeling the need for a novel treatment to come in because abstinence only, as many of us know, has a very low success rate. Suboxone and methadone are great treatments and they work for some people, but however, they are not the right treatment for everyone. And actually, Suboxone, for Suboxone to be called a treatment doesn't really make sense because it's not a treatment. You're not actually treating the underlying issues. You're making it so they're not in withdrawal and maybe their cravings are taken care of. But it's almost like when I was on Suboxone, I thought of it as being put on a shelf for later. It was like I got put on pause and I was put away for later, but none of the underlying issues of why I wanted to use opioids were really addressed. And so while I think MAT is invaluable, I also think it's not enough. And I think that there's people that really want to work on their stuff and move on from being on opioids, and that should be an option. I had a 19-year-old woman call me a month ago who wanted to do Ibogaine, but she couldn't. She was on Suboxone, and the protocol for getting someone off Suboxone with Ibogaine is much more complicated. And it requires 6 weeks off of Suboxone before you can do it, unfortunately. So she told me the story that the first time she went to get help for her opioid use, the doctor just put her on Suboxone, didn't explain anything about it, didn't explain how horrific that withdrawal is, which can be months, 3 to 6 months of agony, which I've gone through. It's a nightmare. I wouldn't wish that experience on anybody. And so there's tons of people going to get put on Suboxone that are not fully warned about what this entails, that you're going to be on this for a long time. And this woman was heartbroken. She had no idea that she was being put on such an addictive, physically addictive medication. This should not be happening. People should be presented with multiple options when they go for treatment and be disclosed about what option means to them. And so I think Brian has seeing that while Suboxone's a great tool in some ways, it's not really that effective for how many millions and millions of dollars the state of Kentucky is spending on it. He wants to help Kentuckians get to the root of what's going on inside of them, which Ibogaine is great at doing that. It's a great door opener down the path of working on trauma and working on healing patterns. Suboxone doesn't help you do that. It just puts your physical dependence on hold. So it just seems that Kentucky and other states in the US urgently need something that's going to help people dive in and really work on the root causes of this issue.
Yeah. Thank you for expressing that. And it's really amazing that the paradigm you were just sharing there around, say, Ibogaine in comparison to Suboxone treatment, it sounded quite similar to what other people talk about, say, psilocybin compared to SSRIs for depression. Like, I had no idea that it would be so hard to get off these SSRIs. And I know so many people, friends and clients, that have tried to get off SSRIs and they end up very suicidal, or they get, tremors and they lose their vision, and
Mhm.
just incredibly difficult. And the SSRIs don't really heal. They're not a treatment at the source. They kind of just paper it over and allow you to function in a traumatizing society a bit more, to fit in
Yeah.
a bit more. And
Yeah, it's like my goal is not to help people be functional within capitalism and be productive and have a career. I want people to be able to be happy and be at peace with themselves. That's my goal as a therapist. I don't want to just slap on a band-aid and send them back out into the world. It's like, let's work on this stuff if the person's ready and wants to. But like, let's create a safe environment for people to work on their deep issues so that they can enjoy life. One of the hardest things when you stop doing opioids or any substance that you've had an issue with is relearning how to have fun without the substance. It took me a couple years to even enjoy things that I was going out to do with friends. It was such a hard thing to relearn. And this is really sad. And it's not something that was talked about at rehab. It was really focused on hard work and taking responsibility, and everything just felt really heavy with the way that treatment was constructed. But what about people having joy? What about people feeling happy to be here on this planet? How can we help people do that? So that's what I like to keep in mind when I'm thinking about how are we going to design a clinical trial and a continuum of care for the participants and people who will use this treatment in Kentucky in the future, is how are we going to help people to be happy, to be here, and to contribute to the communities that they're in.
beautiful. And yeah, just to emphasize, at one point here is that for a lot of people that have experienced challenges with substance use, abstinence only is often not enough. Like, that might be part of it for some, or definitely for a lot in the beginning, but for the rest of life, yeah, there's more than just abstinence only. And I think that thriving, that joy, that just sense of meaning, and the deep healing from within is super important. Um, I wanted to stick on Kentucky now because it is super important. Can you just tell us more about the proposal itself? Like, if this is approved, if it does move to the next stage, what would it look like? So you spoke about, research and kind of the protocol that's going to happen there. What's the training going to look like there? The infrastructure, the pathways, from the average client journey, if that's
Mhm.
okay.
Yeah, I mean, we're just at the beginning of conceiving this. And so we haven't really dove in and created like the true structure that we're going to adhere to for a clinical trial like this. But the concept that we've been talking about is that this isn't just a clinical trial for Ibogaine. for opioid use disorder. This trial is going to be Ibogaine treatment paired with something called integrative harm reduction psychotherapy that you know about, David, that was created by Dr. Andrew Tatarsky, psychologist in New York, who I got my training under. So integrative harm reduction psychotherapy is a methodology for working with people that supports people in creating their own goals rather than pushing one particular agenda like abstinence only. When you do IHRP with a client, you're supporting people in discovering what their goals are for themselves and how you can get there in a slow, careful, conscientious way rather than just shoving them into one specific goal too fast. It's about empowerment. It's not about like a hierarchical approach of telling people this is, this is the way that you have to do things. You have a disease and don't let, a lot of what I remember from mainstream drug treatment was a lot of don't listen to yourself, listen to us. So IHRP is the opposite of that. It's we want to listen to you. What are you hearing from yourself? And a lot of times it takes a while for people to even be able to trust themselves and listen to their own voice. So integrative harm reduction psychotherapy is really about that. And in my opinion, that's the only logical accompanying protocol to psychedelic therapy is this empowerment approach, because everyone's experience in the world is so unique and different. There's never going to be a one size fits all solution or goal for people. And so we wanted to pair IHRP with Ibogaine so that we can help people, and they'll start doing this protocol before they even do Ibogaine. They'll be working with a therapist ahead of time to kind of lay the groundwork for where they want to go and what are the things they want to work on, and then they'll continue working with the therapist afterwards using this protocol. The other thing that we want to do for the trial participants is have them in an inpatient setting for probably about a month afterwards. And then after that, there'll be like a gradual step back to, like maybe like a halfway house type of situation. And then after that, there'll be support for employment. There'll be support for people finding community. We'll probably have some kind of group meeting for the study participants as well. But it's going to be a long process, and people are not just going to be thrown back out to live in, for example, an abusive environment. Like a lot of people have, unfortunately, abusive family members or significant others that they have to go home to after treatment. And it makes it success a lot harder. And so we're planning on making sure people are safe and making sure people are in a healthy environment, whether that be halfway house, whether that be some kind of job training, whether, definitely healthcare, definitely the therapy is going to continue. And so we're trying to make this a full package and not just the participants come take Ibogaine and then that's it. We want people to be taken care of, and we want that model to be the model for people in Kentucky who end up accessing Ibogaine treatment once this is passed.
Hmm. Quick question, Juliana. It sounds amazing. Is this study going to be only for folks that have a diagnosis of opioid use disorder
That's the plan. That's going to be the focus
initially?
for this one.
Okay.
Although, of course, I've worked with people in Ibogaine treatment from who are using all different substances or who are
Mm.
not even coming in for substance use issues and who are coming in for trauma or depression, anxiety. But this study is going to be opioid use disorder. That's the focus, because this is opioid abatement commission funds, and this is the focus right now in Kentucky is to work on this.
Mm. And why Ibogaine in particular? Like, what is it that we know so far about Ibogaine that suggests it is effective, in particular for opioid use disorder?
Well, there's a number of reasons of why it's so effective. But let me tell you, Chris, in my experience going through mainstream treatment, and I did all kinds of different detoxes. I did methadone and Suboxone. I did many cold turkey detoxes. I did every kind of treatment you can imagine. When you go through Ibogaine treatment and you come out on the other side, and almost all of your withdrawal doesn't happen, it's just gone. It's pretty unbelievable. And so this is one of the big things of why Ibogaine is so famous for opioids is it allows you to skip about 70 to 80% of the detox symptoms, which nothing else in the world does but Ibogaine and other opioids, of course. But Ibogaine is the only not opioid that allows you to just skip withdrawal. When you, as a opioid user going through that experience after countless cold turkey withdrawal experiences, It's unbelievable. My mom said I kept telling her on the phone over and over again, I'm not in withdrawal. And she was like, I know you already told me 10 times, but it was so unbelievable to me. I was just thinking at any moment the withdrawal is going to come, right? Because I had such a high habit. But Ibogaine, because of the way it sits on your opioid receptors, and it doesn't activate the part that gets you high, but it's almost like holding the place of opioids in those on those receptors, and then it very slowly leaves your system, is why you get to skip most of that withdrawal. So that alone in itself is absolutely miraculous. And there's no other. I remember coming out of Ibogaine thinking this is the future of opioid treatment. The other thing that it does is it has a resetting effect on your dopaminergic and serotonergic systems, which we don't fully understand because the research has been limited. But I've experienced it. I've watched all my clients experience it. What seems to happen is there's a reset on those receptors. And so you come out of Ibogaine feeling excited and inspired about life. For me personally, and for many of my clients, what I felt was Ibogaine showed me that everything I had been through, all these things that I felt shame and guilt over, suddenly made sense. I suddenly saw how they had purpose and meaning and how they were actually my training to do the work I was meant to do in my life. So all of the shame and guilt I had been carrying about being an opioid user and about not being a functional member of the society was just gone. I saw its meaning. I saw its value. I felt that I suddenly had a purpose and that I was connected to life and I was happy to be here. I was, for the first time, I was really happy to be here on earth. And it's pretty amazing to see someone, for example, I worked with like a 15-year meth user once, and the 2 days after they did Ibogaine, they were talking about all these ideas that they had. They wanted to cook meals for the other clients. Normally, when you get off something like crystal meth after that long of a time, you are not excited to be here that quickly, especially opioids. I remember making it 6 months off of a detox, not using, and still feeling depressed and anxious 6 months later, still feeling completely unmotivated and not passionate about anything. But with Ibogaine, as soon as I came out of that experience, I was lit up and yeah, just inspired to be here in my body and on this planet. So there's not really, when you talk to people who go through other detox protocols, that doesn't happen. So to me, Ibogaine is just leaps and bounds ahead of any other type of treatment that's available.
Yeah, you hit it on the head there. Thanks, Juliana. And having worked in rehabs quite a lot and been a director of one, I just remember being like in an IOP, intensive outpatient group, with about like 12, 15 clients, which is usual. And there's a couple of people that are like just full of energy and they get up and go and like, oh my God, I've got my life back. Oh wow, I'm, you know, going to the gym, got my resume, going back to college, all of these really positive things. Without Ibogaine, no one was having Ibogaine there, but just they'd found a way to find themselves and in a sense find that energy within. But most people were still like the same person they were when they were still using drugs. They just weren't using drugs anymore. And so it was actually quite hard for them to be around people that were full of energy and making progress and evolving and growing. And everyone goes at different speeds and there's no right way or wrong way. But I just remember how hard it was for a lot of people thinking, why am I still stuck how I was before? I'm still going through the same
Yeah.
stuff as before.
And this is the issue, is that what strikes me about the treatment system in the US for people struggling with opioids is there's nothing done on the neurochemical imbalance that using those substances for so many years will leave you with. Of course, your dopamine and serotonin is messed up. Of course, you feel awful. Your body, even if you don't use Suboxone and you manage to get off opioids, it takes your body a long time to heal its pain regulation system. And so when you go through rehab, there is nothing done to heal the imbalances. And that's why Ibogaine so amazing, is because it seemingly resets many things in your brain, in your neurochemistry. Sometimes in rehab, they'll throw some psychiatric medications on you, but again, that's a band-aid. It's not actually addressing the underlying imbalances. One of the Ibogaine clinics I worked at also worked with a number of supplements and neurotropic substances to help balance out the different neurochemicals in the brain, which was also amazing to see. And so I think that that's just also a huge lack in what we have available in the US, is nothing is done to actually heal the imbalances. So of course people feel awful. They're going to outpatient. They still feel like
Yeah.
crap. They're not feeling inspired. You can't talk your way out of a neurochemical imbalance. You need some other
Mm.
kind of therapy to address that.
Yeah. Yeah, and that's why it was so hard to continue doing the work, knowing that a lot of the folks just can't get that part of them healed, and it takes years, I think. And just looking at cigarettes and nicotine addiction, how long that takes to kind of get out the system, or even just sugar. But yeah, opioids, and if people have been using opioids for a long time and been through quite a few detoxes, it takes a lot out of them on
You're not going to think
emotional
it.
level,
Yeah.
neurological, but also spiritual. And I
Hmm.
think Iboga from West Africa has evolved over generations in quite a spiritual framework as with elements of rite of passage. And I also wonder whether, because of our society losing a lot of its spiritual rites of passage and our sense of just meaning making and just cultural cohesion, whether having these psychedelic treatments actually help us to find that part of ourselves and to find it more in life itself and in being part of a community where it is more meaningful to function as an adult in our societies.
Hmm. Yeah, I think people who are coming from traumatized backgrounds, who came from families who weren't emotionally available, who were bullied in school, are not that excited to be here because it hasn't been good for them. So what are we going to do to help people to be actually happy to be here and to be connected to something? And so that's, yeah, the spiritual element of that is really important. I think a lot of people associate spirituality with religion, and that's not always the case. You don't always need to be a part of religion to have a spirituality. And what I've noticed with Ibogaine is even people who are agnostic suddenly feel very connected to life, and very inspired, and they are able to see meaning and all the things that are happening around them and in their past. And it's a really beautiful process to watch.
Yeah, that's great to see, isn't it? And this is a totally agnostic process. There's no religious agenda being pushed in psychedelic treatment. And looking at the work of Stan Groff, as we do here at Psychedelic Today, and particularly in our 12-month vital course, and I popped the link in the chat there if anyone's interested. And Juliana is one of our teachers. Um, we come from the lineage of Stan Groff, so we talk a lot about this kind of inner healing intelligence and this kind of transpersonal states of consciousness and psychology. And ultimately, I think the framework that we need to understand reality, society, and the process of healing from is a transpersonal state, which has aspects of spirituality. And there's part of us that is, we could think of it as a soul, but if that makes us feel a bit uncomfortable, because it's like, oh, don't tell me what I've got inside of me. Okay, it's this inner healing intelligence. It's something like there's something inside of us that just wants to feel whole again, that wants to feel lighter, that wants to be happy, and it's coming from within me, and I'm going to embrace that piece. And I think, yeah, I'm really happy that this way of doing treatment incorporates those aspects of being a human being, not just the purely neurological, the purely cognitive behavioral aspects of being a human. It is more this spiritual piece that is more also embodied. Like, I think we've lost contact with our body. And how I was talking about trauma for me, Juliana, is, I come from I'm a Jew. I've come from many generations of genocide on three different branches of my family. And so living in Israel now with the massacres that happened recently, I felt my trauma come up more than I've ever felt in my whole life. Just physically, like literally my body just shaking, and my wife as well. And just, God, that's generations of trauma there. And
Mhm.
definitely, I could use drugs to help for that, and I have used cannabis in the past to help for that. Um, and I think a lot of the reasons why people are using drugs is to help, just to ameliorate and moderate those symptoms. But
Mhm.
we might just go to anything else. We might just want to zone out and watch TV, or go to the gym and just run 10 miles just to get that out. So we've got it deep inside of our bodies, and we often know it's there. We just don't know how to help it heal and express itself.
Mhm. Yeah. Yeah. Thank you for
Yeah.
sharing about that, David. I think that everybody has a reason for doing whatever drug or behavior they're using to cope with what's going on. We all have a really good reason. And it's not just because we were born with a brain disease. That has been disproven scientifically. People are a product of their circumstances, they're a product of their family system, of the societal system they live in. If it wasn't for the situations I was dealing with growing up and getting bullied really severely in school, I wouldn't have wanted to use opioids. I wouldn't have needed to use opioids because I would have been happy to be here. And so I think that's really important to recognize is that we have to spend time with each person understanding the systems that they're a product of so that we can help to rectify it and help to give them a safe and nurturing environment that maybe they haven't ever had. But no one goes and does fentanyl or meth for no reason at all. It's addressing something. They're medicating something, and society, unfortunately, isn't providing something healthier for them to use to deal with this issue.
Yeah. Yeah. And so it can be a logical decision to use with the
100%.
tools that we have available.
Mhm.
I want to move to questions. We've got a couple of questions. If anyone else wants to ask a question, pop it in the Q&A box. And maybe just as a segue into the questions, I remember being at the Horizons conference in New York a couple of years ago, and Gul Dolan was presenting a paper that she'd done, and it had this amazing graph. If you want to find it, folks, Gul Dolan, um, and it showed the correlation between the half-life of a psychedelic compound and then its actual kind of window of effectiveness. I think it was particularly neuroplasticity. And so she was showing that the longer the half-life of the actual trip itself, the longer is, the neuroplastic window and the long-term benefit. And they showed, the shortest window is ketamine. It's hour and a half. And maybe when you're tripping and the benefit, neuroplastically speaking, is, a couple of weeks. And then far down to the right of the graph was Ibogaine, and
3 months.
it's,
They clocked it at 3 months, and she said it could be longer. It's just that they stopped measuring it at that point, I believe is
yeah,
what.
were you there in New York as
Yeah.
well?
Mhm.
Yeah. So for me, that was the first time I saw that. I was like, oh my God, this Ibogaine's amazing. Like, it literally, it kept going beyond the data points that they were capturing.
Yeah.
What did that say to you when you found out that
I mean,
data?
I'm not surprised. I experienced it. I lived it. I mean, I went from what feels like crawling my way through every day, just being miserable, to feeling excited and inspired and connected to a purpose seemingly overnight. Yeah, like I said, the first thought I had coming out of my Ibogaine treatment was this is the future of opioid treatment, and I have to do everything I can to further the advancement of this treatment. So based on that, it's like this is an amazing treatment, and I think it goes above and beyond what we even know. There's a study that's about to get going on very low doses of ibogaine for Parkinson's, for example. It has a lot of applications, this medicine. It acts on what they think is every receptor site in the brain. It also stimulates the growth of the building blocks of the brain, which is GDNF. So this is an amazing substance, and yes, there are safety risks, but like any medication used in a hospital, there's a protocol that needs to be followed. There's screening, there's monitoring. But once you follow the protocol, it is a safe medicine. And I don't understand what the hesitation is other than, is it just not profitable for drug companies? Is that the problem? Is that why everybody's so held up over it? A lot of medications have cardiotoxic side effects, and it's easily controllable. So it's, I don't, I, for me, holding back this research is doing a massive disservice, and it's essentially leading to unnecessary deaths.
Mm. So if it's okay to ask, what do you think is the holdup? If it's not unique side effects or unique kind of, protocols around, like having the REM strategy, what is perhaps some of the holdup?
I mean, the FDA doesn't really approve one-time treatments. I know that that's been one theory, is that they want to
Mm.
figure out how to make this more of a maintenance situation. I mean, Suboxone's a big money maker. A lot of treatments are big money makers, and I did Ibogaine once and got off opioids for good. That's not really profitable. So there's that theory. I want to think FDA is so cynical and like diabolical as that sounds. I also think that there just hasn't been a company. I mean, passing something through FDA clinical trials, from what I understand, costs on average $500 million, and so you really need a drug company to invest in researching a medicine to even make this happen. And so I think there just hasn't been that investment. Also, in order to make this happen. That's why this opioid abatement fund
Mm.
beginning the trial, because this is really the 42 million is just the beginning of her trial. But that's why this is so groundbreaking, is because this is the first time that amount of money has been pledged to work on Ibogaine in this country. And so, yeah, I think it's a funding thing. Um, I think it's also a time thing. I mean, it takes about 10 years to approve something through the FDA. There just hasn't been someone willing to see this whole process through. But it's a shame, because in the 90s, a clinical trial got started on Ibogaine. We could have had this treatment available already. It's just heartbreaking to think that we could have had this approved maybe 20 years ago, 15 years ago.
Yeah. And I know there are some Ibogaine trials going through. I'm not sure what phase they're at, but yeah, I know there's some big companies with big money that are looking into it. But yeah, like you said, it takes $500,000 in 10 years. So,
Half a
and
billion.
right now, you know, there's yeah, $500 million right now. Yeah, there's so many lives being lost. So we did have a question from Burton Tabak. Thanks, Burton. Um, I definitely can't answer this question. I'm not sure if how it sits with you, Juliana. It says, "Are you familiar with the work being done by Nolan Williams and the lab at Stanford, utilizing ibogaine for addressing TBI and PTSD, aside from addiction? I'm interested on your take for this therapeutic to address neurological indications, stroke, and other organic pathologies." Given the potential for neuroplasticity and promoting healing of white matter. So, similar to what you're saying with Parkinson's just then, but yeah, anything else
Yeah.
around that?
I mean, this isn't my area of specialization, but from what I've learned from Nolan and the people being treated at Mission Within, is there have been really exciting results with working on TBIs. I know in 2016 at our Ibogaine conference in Mexico, um, we had a Parkinson's patients come and say that his daily, very tiny, unnoticeable doses of Ibogaine got rid of, I think it was 75% of his Parkinson's symptoms. And so clearly there's a neurological application. There's a clinic in Portugal who one of the owners has multiple sclerosis, and she had a lesion on her brainstem. And since she's been working with Iboga and doing small doses regularly, the lesion is now gone. Her MS doctors in the US are in disbelief and just are basically speechless by what's happened. And so I think there's a lot of applications to this medicine that we don't fully understand yet. And Nolan Williams, thank God he's doing this research, because it's finally starting to open up this realm of Ibogaine treatment.
Mm.
So I'm excited to see what comes out of this and what comes out of the Parkinson study that's hopefully going to get going soon.
Amazing. Oh, I'm going to look into that. Thank you for that, Juliana. And yeah, similar with MDMA, it's not just PTSD. There's so many other conditions, including, chronic pain and psilocybin, so many conditions that it can have purpose for. There was a question around, yeah, if you could actually just say more about the Ibogaine experience, what actually happens. So maybe I think it's also important to frame this in some of the cultural roots and kind of heritage of Iboga as well, where that came from and how it was used traditionally then, and what the experience is like more now in clinical settings.
Yeah, so traditionally, and there's a religion called Bwiti that's practiced in Gabon and parts of southern Cameroon. They've been using Iboga as a part of their religious rites. They got this use of Iboga from the Pygmy peoples who are using Iboga before that. We don't know. There could even be a much longer history than that. Nobody's really sure. But people who practice Bwiti use Iboga as a part of their initiation to adulthood. And if somebody has an illness, they might use it for that as well. So in that, they weren't working with treating substance use issues or addiction. This is just a part of their spiritual practice. And France brought it back during the periods of colonization, and they didn't really know what to do with it. They made it into a low dose energy pill for a while, which I don't think did very well. It was pulled from the market, and it was just sitting on a shelf for a long time until Howard Lotsoff in the US in New York accidentally discovered that it got him off heroin overnight. And then he started giving it to his friends, and then Howard and Norma Lotsoff are the parents of Western Ibogaine treatment. So the experience when they do it in the Bwiti context, they're eating like the second layer of bark on the root of the plants. They're essentially eating a huge pile of wood shavings. And Iboga doesn't just have Ibogaine, it has other alkaloids as well. And when we're doing it in a clinic for opioid use, most of the time you're using pure Ibogaine, just because it's not convenient for people to be eating a huge pile of wood shavings, especially detoxing. They're probably not going to keep it down. And also because we don't know if the other alkaloids in Iboga potentiate the cardiac side effects or do they lessen the cardiac side effects. This is a big debate in the community, and there hasn't been research on that. So for now, the safest thing to do is working with pure Ibogaine to get people off opioids. So the experience is a little bit different. I haven't done a huge dose with Iboga root bark, so I can't speak from personal experience. Ibogaine itself, people report a variety of different things happening during the experience. It's almost like you're having a dream, but you're not asleep. You're in between sleep and awake. You're laying on the ground. You don't move because Ibogaine takes away your ability to balance. So you have something called ataxia. So you're basically laying still the whole time. Your eyes are closed and you're having visions with your eyes closed. People report things like talking to dead ancestors. Sometimes people will say they went to Africa and they'll describe Bwiti rituals that they experienced. Sometimes people will have really cohesive start to finish stories of the people they encountered and their questions were answered, or something that's really common is people will be physically sweeping out their brains or cleaning out filing cabinets in their brains. That happens a lot. And so you're having a visionary experience, although sometimes people don't remember anything, which that happened to me. And sometimes people just get a series of random images. So it just really depends on the person what happens. I've noticed that men tend to get a clear start to finish storyline in their visions more so than women who might just have more confusing images, more abstract experiences. So it's really different from person to person. One thing that happens though that's really interesting is you get about 1 month's worth of REM during the experience, even though you're not asleep,
Wow.
which we don't really know how to explain that right now without the research to understand that aspect of it. So it's a very intense experience, but it's not like other psychedelics. I always explain it as, psychedelics like mushrooms, ayahuasca, LSD, peyote are more outward, where you're interacting with the outside world, whereas iboga makes you go inward. You're going into your own world. It almost calms down your body and nervous system. It doesn't really stimulate it like other psychedelics. And so it feels like you're being held in a cocoon, but that you're diving deeper inward and you're working on your own emotional themes, if that makes sense.
Beautiful. Thank you, Juliana.
Mhm.
And there's a couple of questions I might merge two together, um, of people talking about their own experiences. So people that say are in recovery already, so have, abstinent, I guess we could say, but not necessarily thriving. Can Ibogaine still
Yeah.
be helpful for them? And then a second question someone's got, what about if someone has been using for so long and has tried everything and they've just been, at the point of no return with addiction, can Ibogaine still work then? So two different scenarios, but can Ibogaine still help?
Yeah, actually, I think people being detoxed already is better in a way because then you don't have to deal. The physical withdrawal, even with Ibogaine, is really hard on the body. And if you've already gone through the detox and your body's calmer and more well rested, you can, in in my experience, you can dive into the psychological aspect a bit deeper because you're not dealing with the physical detox as much. You're more stable. So I think detoxing ahead of time, if that's possible for someone, go for it. That's great. I think that it's safe, it's much safer. It's much easier on the body, and Ibogaine can have its beneficial effects at any time. For somebody that's at the end of their rope type person, I mean, that's where I was. I had tried everything.
Mhm.
I was at the end of my rope. That's Most people end up at Ibogaine after trying everything else. It's usually not like the first line of treatment because people haven't heard of it. It's harder to access. It sounds really outlandish to people at first. And so
Yeah.
most of the people that end up at Ibogaine are people that have tried everything else and who are maybe 10, 15, 20-year users. And so I've seen amazing transformations with people like that as well. I think Ibogaine can potentially be massively transformational for anybody. It just depends on how well they're set up beforehand and afterwards. If somebody's going into Ibogaine thinking it's a magic wand, it's going to fix everything and they can just go back to their same lives, it's not going to work that well. You have to start planning ahead of time for what you're going to change about your environment to support your new life. It's ideal that you're working with some kind of therapist or counselor before and afterward to process everything that's going on. Um, People have to, when you're going into Ibogaine, you have to be really ready to dive into really hard things that you've been avoiding for many, many years. And so, like I always say that Ibogaine is an amazing door opener, but it is a door opener. There's a lot of tools that need to be in place for afterwards for you to be able to process something like this as well.
Mm, really good advice. Thanks, Juliana. And a very interesting point for us to remember here is for a lot of folks to access psychedelics, it is kind of last chance. Like I've tried everything else. Um, but once we break down the stigma, and once policy has changed, and once more research is out there, it doesn't need to be last chance. Like, oh, I've tried everything else, therefore I'm going to do this, or the doctor says, okay, I guess you can try that now. This is going to be for a lot of people frontline treatment. Like this will be kind of gold standard. This is what people can try first without having to fail rehab. Or even I don't like the word failure. Like treatment resistant depression, you've got to fail two SSRIs before you can be considered for other treatments. Like
Right.
so I think this is going to be gold standard. Someone asked a question around using Vivitrol. Someone's been on for 8 months. How does that work with Ibogaine? And is that similar to Suboxone, like we were just talking about, like the 4 to 6 week of needing to having
Mm,
detoxed that?
no, Vivitrol is different. I forget how long you need to be off of that before Ibogaine. If it's an injection, it's probably a pretty long time because of how long it takes to leave your body, but don't quote me on that. I'm more used to dealing with the Sublocade injection than I am Vivitrol. Some people do after Ibogaine get on Vivitrol afterwards, just as an extra preventative measure. For some people that has been really helpful. There was a clinic in South Africa that was giving naltrexone after Ibogaine. And the person who ran that clinic swore by it. So I think it's just different things for different people. I personally didn't feel the need for something like that. A lot of people I work with don't really want to be on anything after Ibogaine. They feel so good already. So I think it just depends on the person. It just needs to be assessed on a case by case basis. But definitely, if that person on Vivitrol wanted to go to treatment, they should discuss that extensively with the clinic, with the treatment provider to make sure that everything's out of their system at the right time.
Yeah, that's part of the protocol. All right, so we're wrapping up now. Juliana, I've just got time for one more question, if that's okay. So Mike is asking particularly about the Kentucky. Sounds like he wants to actually help out. He's at LCSW in Lexington.
Mhm.
Wants to know like where is the study happening and how to get involved. So
That's great. I'm really glad there's LCSW in Kentucky that's interested in this. I don't know yet. I don't know how to answer that. Just stay. Um, I wish I had a place to direct you because we will need you. Stay, keep updated on what we're doing and stay in touch. And we're definitely going to need therapists on the clinical trial. So that, yeah, that will please stay in our orbit. Please, we have an event this Thursday in LaGrange talking about this project, but also other breakthrough treatments for opioid use disorder. I recommend attending that. But yeah, please stay in our orbit so that when it comes time to actually hire therapists and train therapists, that you can be available for that. There's also, I just want to answer the question after that
mhm.
from Tracy. It says, how long was I struggling? And how long have I been free? So I was struggling with opioids for 7 years. Before that, I was doing other drugs, but opioids in particular were 7 years. And I did Ibogaine in 2011. So it's been 12 years since I got out of my opioid dependence period. Actually, I refer to it as my internship now because
Mm.
those 7 years were the most important training that I have to do the work that I do now. And so it says also, is there a point of no return? No, there's no point of no return. There's always hope for people if they have the right support systems. The point of no return is when society abandons people, is when we throw people in jail. That's the point of no return. It's not the person who has a point of no return, it's our society.
Yeah. Thank you,
How
Juliana.
best to stay in your orbit. Well, I'll give you my email for now. That's not like the official
Mhm.
contact mechanism for this project, but I'm not sure what else to give at the moment while we're not completely organized. So I'll just put my email in the chat.
Thank you so much, Juliana. This was great. So thank you everyone for joining in. This was a vital psychedelic conversation, and as I said before, I'll pop it into the chat again. Juliana is one of our teachers, as is Andrew Tatarski, around our 12-month Vital course. So feel free to go to vitalpsychedelictraining.com. The recording of this will be made available. Yes, it will be up normally within a couple of days. So go to our YouTube channel. So I will get that and pop that in the chat as well. It's it's psychedelics today. So definitely tell people about what Juliana and I have been sharing here. You know, this is really important work. This is life-saving, paradigm shifting work on a policy level, but on the individual healing level. So please share this widely. And Juliana, anything else you wanted to share, and particularly, how people could find you other than your email address? If you particularly needed help, like where do I go for finding a good Ibogaine retreat?
I have a guide on my website. I'll put my website in the chat here. Um, it's like a list of questions to ask when you're calling an Ibogaine clinic that mostly weeds out the unsafe people. So you can go to my website to find that. And I also offer preparation and integration support and consultation to families and people and individuals wishing to go to Ibogaine treatment. So you can always reach out to me if you want to do a session.
Beautiful.
Mhm.
Okay. So yes, get in touch with Juliana with any of those questions. Thank you, everybody. And someone's just asking about microdosing there. Um, Yeah, I know someone in Canada that used that, and it was incredibly powerful. And you mentioned a few people, Juliana microdosing ibogaine.
Yeah, that's a whole other world. Definitely
Yeah.
world. Mm-hmm.
All right. Well, once again, Juliana, thank you. This was a
So
really
much for having
amazing
me.
webinar. You got it. Thanks
Yeah.
everybody for tuning in.
Yeah. Thank you.
Take care, everyone. Thanks for listening.
Bye.
Bye.